biological characteristics. In biological characteristics, we are going to study the therapeutic activity, okay, whether your aerosol is giving the therapeutic activity that it is intended for, whether your aerosol is effective or not. At the same time, it should not be toxic in nature. It should be effective also, and it should be safe also. So you are going to study the effectivity and also the safety of your aerosol through the biological characterization. Okay. Now, how you are going to study the therapeutic activity? Okay. Now, the procedures that are applied for your non-aerosols, the same kind of procedures are applied for your therapeutic, for testing the therapeutic activity also, right? Moreover, for an inhalation type of aerosol, if you take an inhalation type of aerosol, when you determine the dosage of the product, okay, that is the assay that you have carried out earlier, okay, so the dosage of the product is related to the particle size distribution. So if you have the accurate particle size distribution and if the assay of the product is good, then you can correlate that these, because as the particle size is right, therefore, and first of all, as the what you call that, as the assay is right, so right quantity of material is present inside it. Secondly, the particle size is also right. So as the particle size is right, so these particles are going to reach to the target area. As both of them are there, so you can say that the therapeutic activity of these metered dose inhalers are being achieved. Okay. Another method which are carried out for non-aerosols, this can be also be carried out where you can give these aerosols to the patient, you can withdraw the samples of the blood, and you can check the presence of the drug inside the blood level, inside the serum level. That can also be done. Secondly, you can test the urine of the patient, okay, and you can check if the metabolites are going to be present inside the urine. If the drug is of that type, then you can check the urine of the patient, and after analysis of urine, you are going to find out whether the metabolites are present inside the urine or not. If the metabolites are present, then definitely the drug has entered into the system and the metabolites are getting formed. It has got distributed, it has got absorbed, it has got distributed, it has got metabolized, and hence the metabolites are present inside the urine. That also is going to give you an idea. So these are the methods that are used for your non-aerosols. These methods can also be used for your aerosols. If the preparation is a topical preparation, right, then in that case what you can do is you can apply that preparation on a test area, right, in the usual manner as you are going to apply when it's going to be applied by a patient. In the same manner you are going to test, you are going to apply it, and after application you are going to find out how much quantity of ingredient is been absorbed below the skin. Okay, what is the absorption of the material that has taken place below the skin? This also you can find by testing your blood samples, isn't it? So that is how you carry out the therapeutic activity. That is how you determine the therapeutic activity of your aerosol. Moving ahead with the toxicity aspect. Now this toxicity test has to be carried out for both the aerosols. You want the aerosol to be effective. At the same time, you don't want it to be toxic to the patient. Okay. This test is carried out for both the aerosols. It is carried out for topical as well as the inhalation aerosols. In topical aerosols, what you are going to check is you are going to check the irritation, right? And the second thing that you are going to check is the chilling effect. Irritation is very simple. You apply the aerosol onto the topical area on the skin, wherever it is intended to be applied. Okay. Then you are going to check whether if the aerosol is producing any irritation to the patient. The second thing is the chilling effect. Now, why is the chilling effect felt when you apply topical aerosol? Now, topical aerosol contains propellant. These propellant, when they are these aerosols, when they are applied on the skin, the propellant they get evaporated. Okay, And as the propellant gets evaporated, it produces the chilling effect. This chilling effect depends upon the type as well as the amount of propellant. If the quantity of propellant is high, then the chilling effect is high. If the quantity of propellant is less, then the chilling effect is going to be less. Also, it depends upon the type of the propellant. So the degree depends upon the type, which type of propellant you are using, and it also depends upon the amount of propellant that you are using. So you determine the chilling effect. How do you determine the chilling effect? You determine the chilling effect with the help of the thermistor. Okay, so this is the thermistor. This thermistor, this word we have seen when during the parental preparations, right? If you remember the parental preparation evaluation, right? Pyrogen testing. At that time, we have said that the thermistors can be inserted into the rectum of your rabbits, isn't it? So these are the thermistors which has been attached to your thermometers. Okay, so these thermistors can be taken help of in order to determine the chilling effect for the topical aerosols. Now, if it is an inhalation aerosol or even if it is a topical aerosol, then the next thing that you carry out is you carry out the toxicity testing. Okay, how do you determine the inhalation toxicity? Okay, by exposing the test animals. You take animals and you expose these animals to the vapors of your aerosol containers. So you put the so you spray these aerosols in presence of the animals and you find out whether it is producing any toxicity. This is not only carried out for your inhalation aerosols, MDIs, but this is also carried out for your topical aerosols. For both of them, it is getting carried out. Okay, this test is carried out.